everybody. Welcome to another session of Virtual English Conversation Group. My name is Shannon and I work at the Novi Public Library. Today's topic is the pandemic, COVID-19. It is currently October of 2020, so we have a lot to cover, a lot of vocabulary. I do apologize in advance, but this is a very important topic. So without further ado, we're going to go ahead and get started. Thanks for watching. Okay, so next are the vocabulary terms. I did warn you that there would be a lot of them, so I do apologize in advance. Everything I'm covering is very important, so I do encourage you, if you don't understand any of the vocabulary terms, go ahead and look them up and see how to use them in a sentence, get some context. I do encourage you to make sure you understand all these terms. They are popping up quite a bit in the news. So the instructions for this next couple slides are going to be pause, read, play. So I encourage you to pause the video, read it out loud, listen to me read it by hitting play, and see how well you do. And you can do it several times, you can do it one time, take your time. A lot of these vocabulary terms are hard to pronounce and are difficult, but I do stress they are important. So without further ado, we'll get started. Good luck to you, and hopefully everything will work out. The first vocabulary term, pandemic. A situation in which a disease spreads very quickly and affects a large number of people over a wide area or throughout the world. Pandemic. The second vocabulary term, contagious. Capable of being easily spread to others. Contagious. The third vocabulary term, symptoms. A change in the body or mind which indicates that a disease is present. Symptoms. The fourth vocabulary term, immunity. The body's ability to keep itself from being affected by a disease. Immunity. The fifth vocabulary term, quarantine. The period of time in which a person or animal that has a disease or that might have had disease is kept away from others to prevent the disease from spreading. Quarantine. The sixth vocabulary term, vaccine. A substance that is usually injected into a person or animal to protect against a particular disease. Vaccine. The seventh vocabulary term, COVID-19. An abbreviation that stands for coronavirus and disease. The 19 comes from the year 2019. COVID-19. The eighth vocabulary term, social distance. Also called physical distancing. It means keeping space between yourself and other people outside your home. Currently, the CDC recommends at least 6 feet. Social distance. The ninth vocabulary term, epidemic. A situation in which disease spreads very quickly and affects a large number of people. Epidemic. The 10th vocabulary term. Outbreak. A sudden start or increase of fighting or disease. Outbreak. The 11th vocabulary term. Contact tracing. The practice of identifying and monitoring individuals who may have had contact with an infectious person as a means of controlling the spread of a communicable disease. In other words, this is the practice of identifying and kind of keeping an eye on people who may have had close contact with someone who is sick, and they're just trying to see who else they need to notify to control the spread of the disease. So if you are contacted by someone claiming to be a part of contact tracing, they may ask you where you've been, who you've been close to in the past couple days. They are usually trying to prevent the spread of a disease. So they do a lot of really good and really hard work. Contact tracing. The 12th vocabulary term. Virus. An extremely small particle or element that causes a disease that spreads from one person or animal to another. Virus. The 13th vocabulary term. CDC. CDC stands for Centers for Disease Control and Prevention. This is the branch of the U.S. Public Health Service under the Department of Health and Human Services. They are typically charged with investigation and control of contagious disease in the nation. CDC. The 14th vocabulary term. NIH. The National Institutes of Health. It is the largest biomedical research agency in the world. NIH. This next section is the read aloud section. So what you're going to do is you're going to wait till the video turns to the next section, press pause, try and read it out loud, and then hit play and listen to me read it out loud. So you're going to hit pause, you're going to read it, and then you're going to hit play and listen to me read it. Okay? Take as long as you need to, and don't forget to take your time. There's no rush. All right, on your mark, get set, let's go. It began in the central Chinese city of Wuhan. Health officials think it may have come from a species of bat. At some point, the virus jumped from animals to humans. At first, this new strain of virus was limited to China. Then, reports of it spread to South Korea, Iran, Italy, and eventually made its way across the Middle East, Asia, and Europe. Finally, the virus hit North and South America. This outbreak later became known as a pandemic. The coronavirus has become a global public health crisis. In March of 2020, the coronavirus began to affect the United States. In order to slow the outbreak of the virus and keep hospitals from being overwhelmed, many leaders enforced quarantine measures, requesting that people stay at home. Many leaders across the world also mandated the use of wearing masks and social distancing. Businesses began to close due to quarantine orders. In the early stages of the epidemic, only health workers and other essential workers, those workers needed to keep society running, continued to work, helping those who had contracted the coronavirus. Many government agencies, including the CDC and the NIH, desperately began to work on a vaccine and preventative measures for people to take. Finally, in places where the death toll and rate of infection began to ease, businesses began to slowly reopen again. However, the closings had led to huge layoffs and furloughs. As a result, the economic damage from the pandemic was massive. Millions of people lost their jobs and many businesses shut down due to being closed for so long. Practice. Find a partner and ask each other the following questions. It can be someone in your family, it can be a friend, someone who you think will be of help. Good luck, and remember, take your time. Question 1. What did you watch during quarantine? What did you watch during quarantine? Question 2. Did you do anything fun during the pandemic? Did you do anything fun during the pandemic? Question 3. How did the coronavirus affect you and your family? How did the coronavirus affect you and your family? Question number 4. How did you first hear about the coronavirus? How did you first hear about the coronavirus? Question 5. The Tokyo 2020 Olympics were canceled. What were some of the events you were looking forward to? The Tokyo 2020 Olympics were canceled. What were some of the events you were looking forward to? Question number 6. What jobs do you think are essential? Why? What jobs do you think are essential? Why? It's time for the final read out loud section. Remember to pause the video, read it out loud, then hit play and listen to me read it. Good luck! People who get the coronavirus have flu-like symptoms such as fever and a cough. Some people may have trouble breathing and may get pneumonia. Because it acts like other viruses, a medical test is needed to confirm that you have the coronavirus. If you or someone you know has tested positive for COVID-19, you may receive a call from a contact trace center. These individuals are critical to helping the community prevent further spread of the disease. They may ask you where you have been in the past few days and who you have interacted with so that they can notify those individuals that they need to get tested. As COVID-19 is extremely contagious, answering their questions can help save lives. The next bit of the video will cover more information on the coronavirus or COVID-19. You don't have to watch the rest of the video, but I really do recommend that you try. It contains a lot of extremely helpful information that could help you and your family, including websites that we suggest you go to for further information. If you have any questions, you know how to contact me. Good luck!